Now, if you're having symptoms of ovarian cancer, or if you're at high risk, or if a suspicious mass or cyst on your ovary has been detected by pelvic ultrasound, usually the next step is to draw a panel of ovarian markers, blood tests, to see if any are abnormal. Now, unfortunately, most doctors even only send a CA-125, and most women only have heard of the CA-125. That's the one that's in the news all the time in association with ovarian cancer. But today, we know that there are several tumor markers that can be elevated with ovarian cancer. And in fact, you can have a normal CA-125 and still have ovarian cancer. So if your doctor needs to send blood work, the tumor markers that you want to request are a CA-125, a relatively newer one called an HE4, something called inhibin, and then several that are just initials, LDH, HCG, AFP, and there's a newer one called an OVA1, which is a compilation of different protein markers that are found in the blood. All of these can be helpful in really stratifying someone's risk before they go to the operating room of whether or not they could have ovarian cancer. The other really important thing to remember, especially in the premenopausal age group, is that our ovaries make cysts for a living. That's what they do. And a lot of times women can have extreme anxiety because someone has told them they have a cyst on their ovary. But in fact, most cysts in young women, premenopausal women, are just follicles in the ovulation process, and they really go away on their own. So that's really important to understand. The other thing is, if there is a strong suspicion of ovarian cancer and your doctor recommends surgery, it is critically important that a GYN oncologist, a GYN cancer surgeon, does that surgery. A lot of times a general gynecologist will say, well, I can do the surgery. We all are trained to remove ovaries. We're not all trained in cancer surgery. So in this day and age, you should go to the operating room with a GYN oncologist rather than a general gynecologist if there's a strong suspicion of ovarian cancer.